I am the president and owner of Howland Health Consulting. It's a dynamic document. It's based on published standards. It's based on practice, on comprehensive assessment, data analysis, and research, which provides an organized and concise plan for current and future needs or someone with a catastrophic injury or chronic care needs. Because nurse life care planners have a registered nurse license, we have the Nurse Practice Act behind us. And we are entitled, and in most jurisdictions, obligated to assess and provide a plan of care, to prescribe a plan of care for somebody with respect to their response to illness or injury. And so I don't have to have a physician sign off on my nursing care plan, but all those other specialties do. I started out my life as a new nurse in critical care, and I did that for quite a long time, and I got my master's in critical care. And then I was working for a small community hospital after many years in academic medical centers. And long story made short, the hospital was losing a ton of money, and they thought it would be a real good idea to save money by closing the nursing education department. I had to apply for jobs, and I had no intention of taking this job, and I figured in a few months I could get another teaching job because I also taught in nursing schools and whatnot. And to my vast astonishment, I really liked it. I was in my mid-40s at that point, and if you had told me that I was going to be learning an entirely new career, I would have probably spit in your eye, but I did, and it led to what I do now, and I've never gone back to working in hospitals. True case management influences the course of care from top to bottom. When you're a case manager, you spend a lot of time assessing people, researching options, making a plan of care, and collaborating with other specialties. I started learning case management in workers' comp, and I had to learn a whole new specialty, which was mostly ortho and neuro. But you learn a lot about finding resources. You also learn a lot there about working in the insurance milieu. There really is no average day. It goes on, it's different all the time. And there are a lot of days that match, but there's no every single day is the same day. There are legal aspects, for example. In life care planning and in case management, you can work for either the plaintiff side or the defense side, and I do cases for both. I find that there's a huge educational component to just about everything I do, in part because the patient doesn't understand the medical issues or the therapy issues or the evaluations that are being contemplated. There are people that just need explanations on the medical aspects of whatever it is you're looking at. I get a lot of cases from lawyers who have no idea what the medical issues are. They think they do, but they're wrong. And so I can help save them from themselves sometimes, or sometimes I can just make it clearer to them what they could be looking at or what they could be doing, or other documents or contacts they should be pursuing, or what medical specialties they should have for expert opinions, because I know things that are going on and they might not. I think if you want to prepare for doing case management and then going on into life care planning or other related fields, such as legal nurse consulting, I think you need a very broad clinical background. This is not work for somebody who's a year or two out of school. It's just not going to fly, because you need to have a large body of knowledge and assessment algorithms kind of built in, which you can only do over years of practice to be able to do this. I think you also have to be inquisitive, because there's so much more to learn. I mean, you learn all the legal aspects, all the insurance aspects of this sort of thing, all those processes. It's not that hard to learn it, but you have to know it because if you don't, you're not going to serve either the people who employ you or your patients, or if when you get to the point of wanting to work independently, you have to have a very strong sense of yourself as a nurse, because people don't think of this as nursing in many ways, but everything that I do, including this kind of talk, is really based on the nursing process. So those are the sorts of things that I think you need to do before you consider going into case management. In my area of specialty, I think some of the biggest challenges are related to credibility. When you turn on the TV and see a patient on the floor and says, "Oh, clean up on aisle 3, call a nurse," you know, or somebody on Scrubs, you know, a female physician in wearing scrubs on TV. If someone mistakes her for a nurse, all hell breaks loose. Whoever made that mistake gets beat down, and she's very offended. All of that coming together makes nursing look weak and stupid and subservient. Well, I want to tell you, it takes a lot to do what I do and what a lot of my peers do. And I think one of the biggest challenges we face in our present jobs and our present positions, which is different from a job, is explaining how much we know and how powerful our knowledge is and how much we can help people, either through the legal or insurance system, or just by knowing resources that other people do not know. I review a lot of medical records. I get boxes, and I have to say that it is depressing as all get out to see how bad nursing documentation is. I think that so many people don't get a good education anymore. I read documentation with people, nurses, who cannot spell, who cannot write, who do not really give me a picture of what's going on with this patient. Someone who is very, very ill, and they'll write something like, patient says that he feels like he's going to die. Now, when I read that, I want to see something more, that's just totally inadequate. I would like to see higher expectations of nursing students coming in, and higher standards to graduate. They tell me there are more people with doctorates and with master's degrees in nursing, and that's helpful, but it's not at the bedside. They're not doing care so much. And I look at, in large part, I look at what I do as doing patient care. I would like to think that there's more of that going to be around. I think it would be really wonderful if more nurses could band together, unionize, organize, stand up for their rights, stand up for their patients' rights, which is really what we're all about here. And I think that would have been a really good thing to teach us as students. Get in the mindset for that. I think they should ask themselves whether they are prepared for a profession which requires a strong science background, an adequate math and algebra background. You want to ask them whether they see themselves as someone who can deal with people when they're at their worst. Can they stand up for their own rights and their own worth in the workplace? So much of people who go to nursing school have such low expectations of what nursing really is. They're going to be surprised. If you want to look at life care planning and case management, as I said earlier, it's really not a field for a new grad. But for anybody who is interested in looking ahead to their working life, I know this is really hard to do when you're 20 and 22 and 23 and just graduating from your nursing program. And sometimes I think it's even harder for older people who are doing it as a second career. But if you can have the maturity to look ahead at what the rest of your life is going to be, get a good education, prepare yourself for the time when you may not want to or be able to do the physical labor of bedside nursing. Make sure that you prepare for that, because you're not always going to be in your 20s.